that health records are in all manner of shapes. They are in pieces of paper, exercise books, foolscaps, and all manner of paper. But now, with the laws that we have passed, you just need to identify yourself, and the doctor can pull out your health records, diagnose, know what kind of medicine you've had before, know what kind of condition you've suffered from before, and be able to assist you going forward. This opportunity also, we said, we must ring fence healthcare funds using facility improvement legislation. And that is the legislation, the FIF legislation we've signed today into law, both for national government hospitals that are referral and even for all the other hospitals down to the village. This is to protect money that we collect from healthcare facilities, not being used to construct pavements or gates or other pieces of infrastructure, but so that there is adequate resources to make sure that there is replenishment of health commodities, there is improvement of health facilities, and that we enhance the quality of delivery of our health systems. We also undertook that we would setting up an emergency medical treatment fund to cater for emergency cancer treatment, referrals. We know that many Kenyans become destitute because a member of their family had cancer, or they got an accident, or they were in an emergency. We have seen situations where there is an accident or there is an emergency, somebody goes to hospital, and they are turned away from hospital because they don't have a health card, they don't have somebody to sign for them. This will be a thing of the past when we pass these laws. Providing National Hospital Insurance Fund coverage for all Kenyans was one of our undertaking. And we said this time round, it must not have exclusions. And it must cover everybody. Nobody should be left behind. Many Kenyans have asked me often, okay, we want to reduce from 500 to 300. Many Kenyans have asked me, what happens to the person? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity of an insurance cover, so that we can truly say no Kenyan will be left behind. And of course, to strengthen our human capital resources so that we can deliver on this whole universal health coverage endeavor. The enactment of these laws, the Primary Health Care Act 2023, the Digital Health Act 2023, the Facility Improvement Financing Act 2023, and the new Social Health Insurance Act 2023 provide a legal and institutional framework for a new dawn in our healthcare system, with health insurance coverage at a low of out-of-pocket costs are disenfranchising sick people from treatment. The new Social Health Insurance Act will now address financial barriers to health and the existing challenges faced in the National Hospital Insurance Fund Act and establish 3 the Social Healthcare Fund, the emergency and critical illness and universal health insurance, while also promoting to quality services for facility, while the social health levels 4 to 6. The Emergency, Chronic and Critical Illness Fund will pay illness costs once social health insurance is depleted. This fulfills the express should be denied emergency medical services. As you're all aware, this has not been the case so far. The Primary Health Care Act in Kenya, by emphasizing promotive health, the Act introduces a framework for the effective delivery of primary health services through networks that include all healthcare providers, whether they are public, whether they are private, or even faith-based. Kenyans have voiced their desire for change in healthcare, highlighting high costs and limited access to curative services. In community health approach that emphasizes prevention and promotion. Less than a month ago, we flagged off the kits that over 100,000 community health promoters will use in our counties. Tomorrow, during the Mashujaa Day celebration, we shall unveil these promoters and employ each community health promoter will be responsible for 100 households, and they will have kits and phones to efficiently and in an accountable manner. The national and county governments will share the responsibility of stipends for the promoters, and our goal is to bring healthcare directly to Kenyans' doorsteps, significantly improving accessibility. The Facility Improvement Fund Act will counter the decrease in funding for public health facilities, investment leading to a lack of autonomy, fragmented services, and the Act provides guidelines. Autonomy, enabling them to independently retain and manage funds, ultimately improving resource quality of services and also enhance efficiency in the delivery of health. The digital health enabling improved resource utilization. This law will address the existing legal and regulatory gaps in the framework for e-health ecosystem and in matters around healthcare. It has the potential Our national healthcare journey has been long. Indeed, most Kenyans healthcare say the Council of Governors, county governments, development partners, and there are many